Dear students, let's continue with the propedeutics of internal diseases. Our today's topic is devoted by cardiovascular and digestive system disorders. Oh, this topic is so wide that I guess how can me to highlight at least symptoms and signs, key points in suspicion on cardiovascular or gastroenterologic pathologies, or later imaging and lab studies, by the words, diagnostic abilities of these disturbances. So let's start. And first part is cardiovascular system. What's wrong? How to describe it? How to translate the information from the patient during questioning to limited in volume and diagnostically valuable information. And this is a list of cardiovascular diseases. Not all of them, of course. You shouldn't remain them. I won't pronounce all the listed pathologists. They're here to inform you about a wide spectrum of this problem. So, angina pectoris, AMI or acute myocardial infarction, congestive heart failure, all these conditions are interpreted in the frame of well known by you, at least you had it before, coronary heart disease or ischemic heart disease. Another cardiovascular problems are the following: hypertension, myocarditis, arrhythmias, conduction disorders named as blocks or blockades, valvular heart disease, cardiomyopathies, rheumatic fever, and other and other. So let's list the main symptoms, by other words, primary or cardinal one, of cardiovascular pathologies. We'll start since dyspnea, which can be interpreted by patient as disorder of breathing and breathlessness. So we detailed it in a lecture before, but let's stress again. Then edema, chest pain or discomfort, palpitations, syncope, cough, sputum expectoration, and fatigue and other non-specific symptoms and signs. This condition reflects the visual information which can be get in person with first in this list angina pectoris or more seriously myocardial infarction. So is it dangerous? What do you think? I especially inserted such internet available means to stress the slight informativeness of such sources, yeah? But in any case, a visual impression about the patient with chest pain is important in early diagnostics. A Russian pediatrician, Russian clinician, famous, he worked in previous century and labeled it, said the following: there are two realities in some heart diseases, the pain and the death. And look, a century after, that's true. So let's detailize each of listed before main or cardinal symptoms of cardiovascular disorders. And then we'll return to angina, I promise, which were seen on previous pictures. So let's start since dyspnea. I prefer this term because of all information listed as disorder of breathing, impossibility to breathe, some problems with an inspiration or expiration can be reflected by very informative term, dyspnea. It means abnormally uncomfortable awareness of breathing at rest or after physical exertion. It depends on the disease and the severity. Exertional dyspnea after physical exercises. Orthopnea is connected with the previous fourth symptom and means breathlessness when patient is lying down. That's why impossibility to lie down due to provocation of dyspnea is a sign of cardiovascular pathology. Such position, orthopnea, when legs are placed on the floor, can control some volume of fluid, of plasma in the extremities. That's why breathing became easy. Paroxysmal nocturnal dyspnea, some episodes of disorders of breathing, a variant of previous sign, orthopnea. Patient awakes from sleep with severe persistent cough and he can't breathe well. He felt disorder of breathing. Sometimes sputum can be expectorated. So paroxysmal nocturnal dyspnea is important and very dangerous sign of cardiovascular pathology too. Then chest pain and discomfort. Maybe the well-known, most popular in population cardinal manifestation of heart diseases. Quite any organ or anatomic substrate can produce pain, quite any in chest. That's why history is very, very important. You should not only get an information about presence of chest pain as a fact or complaints on chest discomfort, but you should analyze all the possible peculiarities, pain location, radiation, just spread into some areas from primary localization place. Then character, for example, burning pain, or intermittent pain, or stable, or connected with the breathing. All these factors must be revealed by professional communication. What are aggravating factors? Sometimes that's physical exhaustion, sometimes emotional overstrain or something else. Ask your patient about it. Releasing factors must be listed too. Time relationships, length or duration of pain attack, and the same. All these points must be at least questioned and then summarized and interpreted to get impression about possible cause of this pain. Peripheral edema. They can be seen even by a not very experienced student. Pay attention to the patient's feet and legs as the so-called cardiac edemas are started since these places. And a good example of a very expressed leg edema. After pressure, we can visually see the fossa, and then on palpation, we can prove this fact. Palpitation. Palpitation is patient's awareness of the heartbeat, forceful or rapid breathing, beating in the heart. It can be due to disorder of rate, very frequent tachycardia, due to addition of premature beat, due to any change of rhythm, and the same. They can be felt as unpleasant sensation or described with more detailization. What are possible variants of palpitation, their background? Patient complains on palpitation. It can mean the so-called paroxysmal tachycardia. Tachycardia is heartbeat is more than 90 per minute. Paroxysmal means an attack of this palpitation, of these phenomena, limited in time, by other words. Extrasystoles, premature beat before is expected, appeared. Atrial fibrillation is the name of very popular, very frequent disorder of heart rate. All these phenomena will be detailized on the appropriate topics in practical classes. But now let's list at least some variants of causes to be able to link it with our future discussion. Diseases which can produce palpitations are atherosclerosis, mentioned coronary or ischemia heart disease, hyperfunction of thyroid, usage of some drugs, not as abuse only, but recommended by doctor. Some drug can produce side effects. Coffee intake, tobacco, smoking, and the same. Again, this scheme. Pay attention on the right part of this slide. Yeah, I hope you know the name of this method that's well known, ECG. And recorded stripe can show you, taking into account that you didn't learn this topic anywhere, anywhere. You can see different intervals between cardiac complexes. The vertical points recorded in heart contraction. They named as cardiac complexes. So the different intervals between them helps you to speak about abnormal rhythm. And arrows indicate the so-called premature contractions or extrasystola. You remember systola means contraction, yeah? So extrasystola means premature contraction of heart, and it's accompanied by the mentioned palpitation. So the presence of such disorders on ECG can be felt by the patient as palpitation. Let's continue. Syncope, sudden temporary loss of consciousness due to loss of postural tone with spontaneous recovery due to sudden vasodilation or sudden fall in cardiac output. Cough. Some cardiovascular diseases produce cough. It can be due to high BP in pulmonary circulation, secondary damage of respiratory system in heart pathology, and the same. Fatigue reflects non-specific combination of all the non-specific signs. Fatigue, in case of serious disorders, cardiovascular disorders, can be expressed till such severity. The patient can't produce some movements, he is lying down, he can't perform not only any work, but even to go to WC, to get a cup of coffee. So we must consider not only a relatively specific sign, such as palpitations, chest pain, namely angina pectoris, leg edema or feet edema, but also such quite universal sign as fatigue. And we must stress their expression, the degree of this fatigue realization. And as I promised, let's return to angina pectoris. Look, we'll spend so many times with the discussion devoted by angina because really even paramedics or persons who have no medical education can save the patient's life in case of angina to prevent development of such serious problem as AMI, acute myocardial infarction. If your help will be realized in time and correctly. That's why. What does it mean, angina pectoris? That's acute. As a rule, very severe, intensive pain primarily appears in retrosternal space. Then pain is spreading to left part of body, to the left arm, left fourth and fifth fingers on the palm, under the left scapula, to the left part of the neck, and the same. So irradiation reflects this term referred pain. You see, it's typical, very typical for angina. So not only primary localization in retrosternal space. Do you remember the first photo of patients? They indicates by the cyst what's the place of the pain. It was sternal area. So primary pain appears in retrosternal area, then is spreading or irradiates to left part of body. What's mechanism of angina appearance? Angina pectoris means the ischemia of myocardium. The cause of this ischemia is imbalance between demands in oxygen from myocardiocytes and possibility of blood supply to realize these demands, to answer to these requests. It's caused by chemical and mechanical stimulation of sensory nerves endings. And look at this picture. The background of ischemia heart disease is drawn here. You can see artery damaged by atherosclerosis. Atherosclerotic plaque narrows the vascular diameter 2/3 seems to be, or even 3/4, yeah? That's why when patient is performing some physical exertion, he's jumping, he's running to catch the last bus in the bus stop. Some physical exercises produces the increase of oxygen consumption. That's why the supply must be increased too. But look at this vessel, that's coronary artery. There are no abilities to answer, to realize this necessity because of narrowed vessel. So ischemia will be developed at the distant area from this narrowing due to atherosclerotic plaque. This ischemia will be clinically realized in angina pectoris, severe, unexpected pain in retrosternal area after physical exertion with specific irradiation. Patient can describe this pain by different variants. It depends from emotional profile of the patient, his education or her education, and plenty of factors. Your purpose is to reveal these listed key points without reflection, maybe some exotic or emotionally dependent characteristic of this pain. Intensity, localization, irradiation, and what are provocative factors or trigger factors. In our example, it was physical exercises. Look, in case of aortic dissection, for example, pain has another character, another localization. Its name says tearing or ripping, appear unexpectedly, and can be compared with such phenomena as you see in the picture. Acute pericarditis is accompanied with pain, which became worse when patient is lying down. That's why in this pathology, patient will sitting up and slightly he can lean forward. Look, all these examples illustrate the necessity to detailize each type of pain to guess what organ is damaged, what disease can be suspected. Because of the prognosis in some variant of chest pain, as I said above, in case of angina pectoris, for example, is very serious. And your role in prevention of these bad consequences is very high. Let's watch a video. I know you like it. Let's switch on.
Discomfort in the chest is one of the most common symptoms for which people need medical help. Angina, known as angina pectoris, is one of the most important conditions which causes mild to severe chest pain. Angina is a disease of the coronary arteries, affecting millions of people worldwide. Angina causes disability and economic loss, and in most cases impairs a person's quality of life. It also increases risk of fatal myocardial infarction, or heart attack, and death. The coronary arteries originate from the aorta and supply blood to the heart muscle. The word coronary is derived from the Latin word meaning crown, as the three main coronary vessels appear like a crown superimposed on the heart. There are different types of chest pain, such as that caused by indigestion and muscular pain. However, anginal pain is the chest pain or discomfort that occurs when heart muscles are starved of oxygenated blood. Angina derives its name from the Latin word angera, meaning tight chest. Angina, caused due to blockage of the coronary arteries, can be classified in three principal types. These are stable angina, unstable angina, and variant angina. In stable angina, the chest pain can follow a regular pattern in terms of frequency, intensity, and duration, and is fairly predictable, normally occurring after physical and mental exertion. The patient may be aware or unaware of his exertion limitation. Stable angina is caused by a fixed blockage in the coronary artery, resulting in reduced blood supply to the heart. Angina is precipitated when the demand surpasses the supply and is relieved by rest or medication. Unstable angina, as the name suggests, does not follow a pattern and is not predictable. Unstable angina can also be a manifestation of the latter stages of stable angina, where unlike stable angina, it can occur without physical exertion and is not relieved by rest or medication. Unstable angina frequently occurs at rest and is a more serious condition than stable angina, as it may progress to acute myocardial infarction or heart attack. Variant angina is a rare form of angina, which occurs at rest. The chest pain is caused by coronary artery spasm, a sudden constriction of a coronary artery, resulting in a decrease in blood supply to the region supplied by the artery. Variant angina is also called Prinzmetal's angina, after the physician who described it. Atherosclerosis is the single most important underlying cause of angina pectoris. Atherosclerosis derives its name from the Greek words athero, meaning gruel or porridge, and sclerosis, meaning hardness. It is the hardening of the arterial wall and the narrowing of the arterial lumen due to the slow buildup of lipid-rich plaque on the inside walls of the arteries. Plaque is formed by the buildup of fat, cholesterol, calcium, and other substances circulating in the blood. Plaques are of two types.
So let's continue. And next turn is occupied by general examination. Look, all the previous information was subjective. We asked the patient, we have interpreted his or her complaints. Question about taking history are helpful to suspect the damaged system, in our case, cardiovascular one, and get more information about severity of the disease and cause of it, and suspect acute or chronic condition is. Now we are discussing general examination, and we are starting since visual impression about the patient. Respiratory rate in healthy person at rest is 14 plus minus 2. So if more, such term as tachypnea must be pronounced. Tachypnea means more than 16 per minute respiratory rates. It reflects such complaint as dyspnea and may be accompanied with superficial character of breathing. Second word stressed by red is cyanosis. Cyanosis means specific bluish color of skin in case of cardiac disorders. For heart pathology, acrocyanosis is typical. It means peripheral bluish skin, predominantly localized in fingers and nose. So pay attention to the patient's feet and palms, and bluish nails and bluish distal phalanxes plus blue nose are very, very typical for disorder of cardiac function, because cyanosis is reflection of bad oxygenation of most detached areas from the center, from the main pump of our body. Changes of arterial pulse and blood pressure. How to measure BB we'll detailize next time during practical seminars. And then we should speak about pulse rate. Carotid pulse in norm is 60 to 90 per minute. If more, you can count, for example, any side radial pulse, and it, for example, was 98. Of course, it's more than 90, so we can give conclusion about tachycardia. Frequent cardiac rate is more than 90 per minute. Correspondingly, bradycardia is heartbeat rate is less than 60. In addition, do you remember the complaints about palpitation? Yeah, patient can complain on palpitations, and they are associated sometimes with irregular pulse rate. It names arrhythmia. So irregular pulse, irregular cardiac rhythm can be combined with frequent rate, they name as tachyarrhythmias, and correspondingly, if heartbeat rate per minute is, for example, 40 plus irregular rate appeared, for example, it will be named as bradyarrhythmias. And then we'll discuss imaging studies. This is a short list of the ECG, echocardiography, chest X-ray, CT scan, coronary angiography, and lab diagnostics lab studies. CBS is abbreviation for complete blood count, the standard routine analysis. Lipids profile is very important for patients with cardiovascular system disorders. And tests of coagulation are actual too. In addition, we can check the hormonal level, for example, T3, T4, thyroxine, 3-iodotyrosine, to check the hyperfunction, for example, in suspicion on hyperfunction of thyroid. This is a list only. Now let's detailize. But before we must discuss, at least in some words, this such serious problem as heart failure. Heart failure means in the impossibility to support by blood flow the equal level of oxygen. If heart can't provide equal perfusion of peripheral organs, this misbalance will be realized in heart failure. Picture is to pay your attention only, and detailization is later. So, you will suspect that our heart is divided, virtually of course, into two halves, right, bluish, and left one, reddish, or maybe red or fuchsia color. So, if you suspect such virtual division, it's easy to understand the appearance and signs of heart failure. So, two circulations are divided into upper pulmonary circulation, let it be bluish arrow. So, from right ventricle, blood is passing to pulmonary circulation and then is directed into left atrium. Is it clear? Corresponding the lower patch of this circulus is connected with systemic circulation. This simplified elementary scheme is very, very useful to understand when and where and in what organs fluid congestion appears in heart pathology. So, if heart is functionally sufficient, this pump can support equal perfusion in any organs and tissues. The formula of such good working heart can be limited by words. Input is equal to output. I strongly recommend you to remain this simple formula, this simple definition. It's so clear, yeah, seems to be. But as a rule, if heart is damaged, one half is predominantly involved, left or right one. So let's start with our scheme again. If right side of heart is damaged, this part of pump is broken. Blood can be passed from systemic circulation to pulmonary circulation in 100% of volume. Yeah, let it be due to damaged right ventricle. It's crossed by red. You see, the blood from systemic circulation will be passed to pulmonary one, but only 90%. But left part of heart works well. That's why all the pulmonary circulation content will be transported to the systemic one, to the legs, peripheral organ of the body. So, what's the place of congestion? What circulation does contain more fluid than necessary? Of course, the systemic one, because the excess of fluid will be accumulated first. Feet, then ankles became edematous, then leg edema will appear. You see? So let's remain till the end of your clinical career that in case of right heart failure, the congestion of fluid will appear in systemic circulation. So leg edema, and in addition, hepatomegaly, enlarged liver due to congestion of plasma in this organ, will be typical signs for a right heart failure. Key signs of any type of heart failure are dyspnea, especially worsening of patient's condition when he or she is lying down. Feet, ankles, and leg edema. Rapid and irregular heartbeats, persistent cough, fatigue weakness, and reduced ability to exercise. We have discussed that swelling of the feet, ankles, and legs are key point, cardinal sign of right heart failure. But in case of left one, the most express symptoms are associated with the lesser circulation. In case of left heart failure, the congestion of fluid will appear in lesser circulation because broken pump left side of heart can't transport all the blood from lungs to systemic circulation. That's why the main signs in case of left heart failure will be associated with a congestion in lungs. So disorder of breathing and severe inspiratory dyspnea will appear in this case. Inspiratory, I'd like to remind, is associated with inspiration. So inspiratory phase is more disordered than expiratory one. How to guess that congestion in lesser circulation appeared? It can be done. Can be realized. It can be guessed by visualization with the chest X-ray and other techniques which can see lungs parenchyma and correspondingly increase content of fluid due to bad work of left half of heart. Another serious sign, or maybe even syndrome, if we are discussing the combination of symptoms, it's more correctly to name syndrome, cardiac asthma. It means nocturnal attack of inspiratory dyspnea. Pay attention. In heart failure, in heart pathology, dyspnea is inspiratory. In contrast to attacks of expiratory dyspnea in bronchial asthma. Yeah? So, cardiac asthma makes patient to awake, to sit down, and he felt severe episode of inspiratory dyspnea. If no help realized in this period, such serious complication of this condition with a very bad prognosis can appear. That's named as edema of lungs or lung edema. Pulmonary or lung edema is extremely severe, is life-threatening condition. And that's extremal manifestation of left heart failure. Dyspnea develops suddenly, progresses severely, associated with the perspiration, cyanosis, sometimes tachycardia, or progression of tachycardia. As you remember, tachycardia is typical for heart diseases signs, so it can be developed before realization of heart failure in frame of cardiac dyspnea, so in period of cardiac asthma. And in case of lung edema, foamy raw sputum can appear. This life-threatening sign too. What can lead to such serious problems as congestion and less circulation realized at the level of cardiogenic edema? They are acute myocardial infarction, non-treated hypertension, produced stroke, acute overload of the left heart in mitral valvular heart disease, and rarely myocarditis. All these listed diseases can lead to previous slide, to this extremely severe condition. So this is consequence which can be treated immediately, must be treated immediately. And this is background, the diseases which can lead to this complication. Complaints were discussed before. I'd like to summarize it for you, please. If necessary, you can stop it and analyze in details. Chronic heart failure means advanced stage of disorder of myocardium and other layers of heart, which is associated with the impossibility to contract effectively. So impaired pump function appeared. And from the second side, relaxation of the heart is damaged too. So heart became insufficient. That's why input won't be equal to output, as we discussed before. Symptoms of heart failure are listed here. They are discussed before, but for summary, it's okay to reproduce again. Next method. We are starting since the well-known imaging study of cardiovascular system. That's well-known ECG. Of course, I won't explain you all the phenomena, all the electrophysiology and variants of disorders. It takes time. It will be discussed to be able to realize emergency help, first aid help for any patient during your practical classes and next term lectures. But now I'd like to stress the role and show you the simple patterns which can be diagnosed with ECG only. So, two key points, two main problems which can be disclosed on ECG are arrhythmias and myocardial infarction, especially AMI, acute myocardial infarction. And look, typical picture in case of myocardial infarction is on this slide. Now some comments. Look, to make your life easy, not only yours, but all the doctors, all the students, medical students in all the world, some visual associations are using. So, changes on ECG in acute myocardial infarction are starting since such changes as elevation of AST above isoelectrical line. Isoelectrical line, this is line recorded when the heart has no electrical activity. But electrical excitation will lead to recording of waves and some intervals. And pay attention of the cat, the shape of its body, and correspondingly on the placement of this ST. This wave named as P, this is Q, this is R, S, T. ST elevation, look at this slide again, excuse me, this one, will inform you about the dangerous condition, acute myocardial infarction. Even now, look please on this ECG. ST segment elevation is marked by bluish. Let's return to ECG from the patient who has no infarction. Look, ST is horizontal and placed along isoelectric line. You didn't learn ECG, You don't know all the peculiarities of its recording and mechanism of forming always, but even you, since first sight, can compare the placement of some interval named as ST along isoelliptical line, and then look, ST elevation can be seen on this picture. This is ST is placed on isoelliptical line, and this is above. Can you make it? I think yes. Let's look on this ECG. I show you. Oh, excuse me. I want to zoom it, but that's impossible in this regimen, unfortunately. So look at this ECG. This patient has ST segment placed on isoelliptical line. This, this. But this one, this ECG has ST elevation. ST elevation. Compare this complex ST elevation and this one. This is isoelliptical line. This is no. It must be recorded here, but instead of it, ST is elevated. So this patient has infarction. Let's guess. Has this patient ST elevation or no? Let's look. No. ST is below isoelliptical line, not elevated. This one. ST is above isoelliptical line, and here much more expressed, and this lead too. So this patient has ST elevation, so we must consider him as a person with AMI and realize first aid immediately. Another association, they depend from the stage of AMI, will be discussed in frame of practical work with the teacher in detailed analysis of ECG. But now I only show you the abilities of this method, valuable to diagnose infarction. Here, an example, yellowish areas, they mark ST elevation. You see, maybe it's important. Maybe it's seen for you. That's a general impression about method. I promise we have a time to speak about it in classes. That's another association corresponding to the late stage of infarction. Look, this patient has isoelliptic line at the place of ST again. So infarction is transformed to another stage. I'll stop with an ability to diagnose infarction here. My purpose today is show you the role of ECG diagnostics in such serious problem as AMI, including AMI in dentist room. Another problem which can be easily diagnosed in ECG is arrhythmia. Do you remember the complaints in persons with CVS disorders? Palpitations, yeah? When you can palpate pulse and felt the same, yeah? Irregular rhythm. And then a recording of ECG will be most informative and show you the different intervals between the waves, you see? These acute peaked waves, named as R waves, they have different intervals between first and second and third. So this is a picture of proved arrhythmia. By other words, ECG can prove your opinion about disorder of rhythm and visualize the problem. So that's valuable quality too. Another variant of pathology. Look, even your inadopted eyes can see then and and long intervals, yeah? So this is arrhythmia again. Visual verifying of patients' complaint and doctors' results of palpation of pulse. Another arrhythmias again. This is more expressed, yeah? Such horror waves. On glasses, you'll know what does it mean. And this arrhythmia is not such expressed, such visually informative as previous, but can be proved again as the intervals are different too. Next method, non-invasive again, SECG. That's echocardiography, the heart or cardiac variant of ultrasonography. Can be performed since first days of patient's life, if necessary. These dark horror spots can't be very informative for you now, but I'd like to show you some examples of video and maybe it will become more informative. So look, this dark and white combination of spots, of lines, informs the professionals about heart contraction, the size of each chamber, the valves condition and work, and a lot of valuable information can be seen in dynamic as heart contraction will be recorded. Moreover, we can even hear the sounds from the heart, working heart, during these cycles of contraction and relaxation. Let's try to watch, maybe. Look, this is the left ventricle, and this is one, and this is left atria, and this is mitral valve. Can you see? You see bicuspid valve, and you can see how does this valve work. The question: does it mean rhythmic or arrhythmic? Try to check. Arrhythmic, yes. As intervals of contraction are different, you can see the thickness of layers, and this is right ventricle, this is right atrium, and look, even blood flow can be seen, and regurgitation of some volume of blood into contra direction can be proved. You see, very interesting video. You can adopt your eyes to divide where is left ventricle, right ventricle, right atria, left atria. So if you suspect what's the scheme of chamber placement, you can see what's wrong and how many information can be get from this method. You see, that's non-invasive, that's relatively non-expensive and available in plenty of cardiological departments in clinics. Great, yeah? Seems to be the applaud. But technically, this is a problem with these valves. Look, not only arrhythmia, but opening of this valve is not correct. Let it be. So it was abilities. Now, I don't like music here, but in other projection you can see the same pathology. So the purpose of this movie is to show you the abilities of method. Let's summarize. Ultrasonography can help you to see heart size, not only of all the heart, but each chamber, thickness of each wall, valvular apparatus, the work of each valve, the ability to be opened, and the same. Valuable, quick, informative, and not expensive method. Some was about X-rays. They are less informative in CVS disorders than in pulmonary one, but sometimes chest X-ray can be used as a rule for diagnosis, differential diagnosis of some problems. But I especially didn't include chest X-ray in this lecture because of it not the most actual here. Another method is radionuclide angiography. If necessary, we can visualize much more information if necessary. And this method is recommended for those who has such serious problems which can't be revealed by standard scheme of examination. What's new in pre-hospital stage of diagnostics of vessel disorders, including the atherosclerosis? Do you remember the picture with the narrowed coronary artery due to atherosclerotic plaque? Yeah? The same, yeah. How to prove it? We have some abilities realized by duplex or triplex ultrasound tests. How to see arteries? Please look. This is Doppler ultrasound test, and blood flow can be considered in large arteries and veins. Quite informative. The same picture. They are from peripheral artery scanning. You see, the diameter, the thickness can be considered, the presence or absence of some abnormalities. So very informative, non-invasive peripheral arteries, Doppler scanning. Triplex ultrasound or color flow imaging can be added to this list of informative, non-invasive imaging studies too. Such procedures angiography can visualize quite all the peculiarities of blood flow in the heart. Let's see, I even won't discuss it by words, but let it be in pictures, yeah? Look, at the right side, you can see coronary system. All the main branches, arteries, waves, and the same. Another example of valuability of this method is here. This angiogram showed the presence of narrowed artery. Yeah, you see the picture which reflects atherosclerotic plaque in coronary artery can be inserted here as the objective. Confirmation of it is on coronary angiogram. So narrowed coronary artery is a background to develop ischemia, and clinically it will be complained on chest pain. Do you remember? Angina pectoris can be developed in this patient. Very severe narrowing, you see. Compare with the previous and consequent diameters, yeah? That's plaque. And here you can see the results of treatment. Surgery can help in this situation. And third patient had quite obstruction, yeah? Quite no blood flow through the narrowed vessel. But here, blood flow was restored under the control of angiography. Another example, yeah? Absence of blood flow distally from this point. No any branches can be seen. And here, the restoration, the presence of blood flow distally of the previous place of obstruction. This patient had AMI due to quite complete occlusion of the damaged vessel. But to guess, does it mean infarction or no? Of course, we can perform patient's examination. Another site of investigations in coronary vascular disorders is lab changes. Doctors prescribe creatinine level in plasma, some hormones level, example, aldosterone, renin, angiotensin, and arterial blood gas concentration can be checked in persons with, for example, cyanosis, and the same. And now, please, attention to the most dangerous situation in your future work. What's most dangerous, either for dentist who is performing some stomatological procedures in oral cavity and for the same patient who can develop serious emergency conditions. First, AMI, acute myocardial infarction. Second, high BP, hypertensive stroke, and acute arrhythmia or paroxysm of tachycardia. These 3 points cover quite 90% of acute cardiovascular problem can be developed in your professional sphere. When you are examining patient or when you're performing your professional procedures due to another reasons. So, in case of listed conditions, high BP, acute myocardial infarction, acute heart failure, etc., the main tasks are to suspect the presence of this disorder. If you even suspect that this condition means the ability to die in your chair, to develop serious complication, it will be first good step to saving of patient's life. Second, ask the appropriate help. Call for ambulance, the head of your department, if it's a large clinic with not only dentistry but another departments, with recording of ECG and the same. And then, to save patient's life, he or she must be hospitalized, must get specialized help. So that's all about cardiovascular disorders today. We'll continue some minutes after, and it will be another topic, gastrointestinal pathology. So a short break. If you don't want to wait, you can miss next 5 minutes, but they said that I must perform a break even in recording lectures, so I'll follow this recommendation and meet you again 5 minutes after. So let's continue. Symptoms and signs with gastrointestinal disorders. Let's look. What's unexpected can appear in the dentist's sphere. If we are discussing patients with pathology of digestive system, all the possible complaints, all the possible problems, all the possible indications to ask about their health are combined in two main groups. They are pain and dyspepsia. As this system named as gastrointestinal, the main mission of it is to digest. Yeah, that's why dyspepsia means literally disorder of digestion. That's why all the signs which reflect disorder of digestion must be listed in this yellowish square. They can be, for example, nausea, vomiting, bad smell from the mouth, eructation, heartburn, constipation, diarrhea, meteorism or bloating in the abdominal cavity. Plenty of signs which are combined by the only common feature. They are associated with disordered digestion. So they will be listed in this sphere. Second side of problem of all the symptoms and signs in gastroenterology, they reflect pain or discomfort or unpleasant feelings or maybe even colic, extremely severe pain, an attack of acute pain named as colic. For example, biliary colic is available if stone is obturated the bile duct. It will produce very severe pain named as colic. But pain is typical quite for any disorder of gastrointestinal tract. That's why what's peculiar, I'd like to stress right now that if pain appeared and you have suspected gastrointestinal pathology, and how to suspect it if pain? This patient will have dyspeptic complaints too. So let's model the situation. Person developed some signs of dyspepsia, and in addition, he had pain. If pain is associated with the GIS, your responsibility is to ask the patient about connection with the food intake. So the key point of damages of upper gastrointestinal, upper part of gastrointestinal system is more or less expressed connection of pain appearance and food intake. Sometimes patient can say, oh, I felt pain when I was hungry, or at night I was awakened due to pain, I was hungry, it was intolerable. Some patients can say, pain appears maybe 15 or 20 minutes after food. Sometimes pain can be felt during a swallowing process right now after he starts the food intake. What's valuable here? You can suspect the level of damage in case of gastrointestinal system, either esophageal or rectal problems if pain is connected with defecation. So the key point in questioning in diagnostics of any pathology of gastrointestinal system is accompanied with the professional collection, professional taking history about complaints and connection of all these things, dyspeptic complaints and pain complaints with food intake. Now let's detailize. You can have such name, long, such bulky abbreviation, GERD, named as gastroesophageal reflux disease. Reflux or regurgitation can appear in healthy person as a physiological phenomena episodically without complaints, sometimes after a meal. But a gastroesophageal reflux disease occurs when the amount of gastric juice that refluxes into the esophagus exceed the physiological level, and it leads to unpleasant feelings named as heartburn, acid test in oral cavity, for example. So it causes symptoms. So it means pathologic. As a rule, the consequence of this stable pathologic reflux, it will be esophagitis, inflammatory damage of esophagus. Let's list the key complaints in gastroesophageal reflux disease. They are heartburn due to regurgitation of acid content of stomach to the esophageal area. It can be felt as burning feeling in retrosternal space, named as heartburn. Regurgitation. I won't comment, that's clear. and dysphagia. Person can't swallow effectively. Impossibility to swallow food, sometimes impossibility to drink. So this triad, heartburn, regurgitation, dysphagia, is typical for damage of esophagus in case of gastroesophageal reflux disease. Another great problem of century previous this century is Helicobacter-associated disorders. They are chronic gastritis, Helicobacter pylori chronic gastritis, and peptic ulcer, predominantly duodenal ulcer. You had such words, so this is a time to get a place, appropriate place for this phenomena. So, either chronic gastritis or duodenal ulcer, if they are associated with well-known Helicobacter pylori, you learned it on microbiology, they are considered in frame of Helicobacter pylori associated disease. What's wrong with the patient? What are typical complaints? Let's start since dyspeptic one. So they are burning, sour eructation, nausea. All these signs are dyspeptic. And second side, as I promised you, is pain. Pain is placed in epigastrium localization, epigastric localization. And as a rule, in case of gastritis, it appears 15 to 30, sometimes 40 minutes after food intake. Or if duodenal ulcer developed, it will be an hour till quite 3 hours, or more expectedly to 2 hours after meal. So, what's peculiar in this pain? Exact connection, strong connection with the food intake, either in gastritis early or in ulcer later. What's peculiar else? This pain can be relieved, temporarily of course, but relieved by antacids. Such drugs neutralize acid content of stomach and relieves patient's condition. But in our epoch, we can trust only discussion with the patient and even only our objective investigation of him. That's why any pain or discomfort in the epigastric area, any symptoms connected with the possibility of gastritis or intestinal dyspepsia, all these things are direct indication to perform our next method of investigation, next imaging study, upper gastrointestinal endoscopy. So, either pain in epigastrium or discomfort or intestinal dyspepsia, person must be directed into endoscopy. Taking history and physical examination, for example, we can palpate abdominal cavity and objectively reveal, not only the background of the patient's complaint. Yeah, we can reveal pain, local or diffuse in some or one area of abdominal cavity. Yeah, but diagnosis on basis of complaints and physical examination can be considered as preliminary only. In internal diseases, in all the medicine, each suspicion, we can consider diagnostical suspicion or preliminary diagnosis after physical examination only. This suspicion must be proved by verifying method. In case of gastritis or duodenal ulcer, it will be endoscopy and biopsy for histologic study. Upper gastrointestinal endoscopy can solve 99% of differential diagnostic problems. That's why instead of prolonged communication with more experienced colleagues, with gastroenterologists, with those who had experience in this sphere, you must prescribe the gold standard of diagnostics. So endoscopy is obligatory. Another reason to prescribe this method is high risk of cancer, for example. And look, we can divide cancer, ulcer, and gastritis at the background of complaints and physical examination with 100% reliability. That's why objective method is necessary. And you can see duodenal ulcer here. Duodenum and space, and ulcer with a yellowish, covered by the yellowish layer. This is ulcer again. Moreover, you can see some dark spots here. They illustrate the hemorrhage. Maybe occult, maybe it was more expressed hemorrhage, but now it's limited by these points. And duodenal ulcer again. This patient had hematemesis and melena stools. Hematemesis means vomiting with a dark ground coffee content. And melena means the dark stools. What's this? Bleeding, you see? Endoscopy reveals bleeding and sometimes can stop it by local procedures. The bleeding from veins can be stopped by ligation of these veins, but that's responsibility of surgical department. That's why I only show you the pictures to prove the valuability of this method and high informativeness. And bleeding again, so many blood in the space of GIS. Now look at this peculiar picture. This is esophagus, and these bluish tubes are enlarged veins, varices veins, in patients with portal hypertension and severe liver disorders such as cirrhosis. Anastomosis in esophageal area will lead to protrusion of such enlarged hypertrophied veins in the space of esophagus. So it reflects on upper endoscopy, esophagoscopy, yeah, literally. Another side of diagnostics of gastrointestinal disorders, if they are Helicobacter pylori associated, is first to prove the degree and character of tissue changes. We have biopsy and we can analyze what's the stage of metaplasia of cells and the same. By other words, we can exclude cancer. Second, here, not second, third, yeah, that count. So Helicobacter pylori testing is necessary too. In addition, intragastric pH metria is available to measure pH and to make conclusion about necessity and efficacy of some pharmacology which can suppress this hypersecretion of acid. X-ray doesn't informative at all. So let's miss this slide. Of course, sometimes in some exclusions it's available, but endoscopy solves 99% of problem. Next. Look, compare. This is a picture from contrasted X-ray. What do you prefer? To diagnose ulcer with such method or with the same one. What's more informative? In addition, here we can get material to prove the presence of Helicobacter pylori. Then we can get biopsy to exclude cancer. So all the questions will be solved by one visual, informative examination and compare the results of this method with this one. Of course, no, we'll prefer endoscopy. Lab studies. So, histology. I want to generalize it. You had the whole anatomy, yeah? That's responsibility of this department, its specialization. I only stress the necessity to perform biopsy to diagnose, to exclude tumor. Helicobacter pylori infection diagnostics. What are available tests? Invasive tests for Helicobacter pylori. They are based on biopsy-based testing. So, person is underwent by endoscopy. We got some samples from mucosa, and this tissue must be analyzed per metaplasia, per presence of abnormal atypical cells, and the same. And in addition, we can culture the material, the causative agents from these tissues, and rapid urease test from gastric biopsy sample can be performed too. Specific metabolism of Helicobacter pylori can lead to changed color in sample marked by pH-sensitive color indicator. So this visual confirmation of presence of Helicobacter pylori, the presence of metabolism typical for Helicobacter pylori, is the background for rapid urease test. Bacterial culture, the most expensive, maybe technically complicated, but available if indicated. Sometimes that's actual if we have problems with antibiotics prescription. If Helicobacter pylori is the etiology of this disease, Helicobacter pylori associated disease, antibiotics must be prescribed. But if no efficacy, if some problem in diagnostics, this test, bacterial culture, can be used. And non-invasive, widespread testing, some of these tests can be bought in a drugstore. Lab serology, it reveals immunoglobulins, antibodies to Helicobacter pylori. This serology has high sensitiveness. Urea brief test, non-invasive, convenient test. Technique won't be discussed maybe, but remember that that's availability to check the presence of Helicobacter pylori without invasive procedures. Stool test antigens. They are informative to check Helicobacter pylori presence too. You see how many alternatives. And now some words about liver diseases. I know you are tired. Me, maybe not tired, but maybe slightly tired, yeah, a bit. But let's finish with gastrointestinal system, at least with some main things devoted by liver disorders. We can't miss liver. Look, yeah. So, right upper quadrant discomfort. Do you remember first slide with two squares? First is pain, second is dyspepsia. So pain means the presence of right upper quadrant. Pain or unpleasant feelings or tenderness, let it be their liver pain in sum, as a sum. Sometimes acute pain can appear in this area. It's associated with biliary dyskinesia or moreover with biliary colic. Very severe pain due to obstruction by stone of biliary duct. Jaundice, the visit card of biliary diseases and liver diseases. If person enter your room to treat caries or to be consulted due to pancreatitis, and you saw the yellow sclera, syndrome of jaundice appeared, yeah? Liver or biliary system diseases detected. But not only, some problem associated with another system can appear, but I won't touch it right now. So jaundice can appear either in biliary or in liver disorders, but not only. Very informative, indicates the area of damage and provokes next questions about possibility of pain and other dyspeptic signs and the same. So it's such expressed hint that liver is damaged, yeah? Dyspeptic syndrome in chronic diseases, for example, hepatitis. Meteorism must be stressed. A disorder of appetite is not stable, sometimes nausea appears, sometimes vomiting, but I'd like to stress meteorism as excess of air in along the bowel and the intestinal tubes. So it will be associated with bloating, with such patients complain. And second important thing is bitter taste. Look, in case of ulcer, in case of chronic gastritis, sour taste, acid-containing content can be felt in oral cavity. It can lead to your special professional problems, which must be treated with your help, yeah? But in liver disease, taste will be bitter. So this is plus meteorism are very informative from the point of view of diagnostics of liver disease or biliary disease. Skin itching. In case of cholestasis, named this term reflects the disorder of biliary flow into duodenum at any level, maybe intrahepatical, maybe at the level of choledoc, doesn't matter. So in general, this disorder named as cholestasis, yeah? So in case of cholestasis, skin itching or pruritus will appear. Look, let's return to clinical side of our communication. Patient comes to see the physician, or he visited you due to stomatological problems. And if first complaint, if first problem unexpected, if it was visit to dentistry department, or planned, if patient asks the physician, is pain or discomfort in right upper side of abdominal cavity. Physician can suspect the enlargement of liver by palpation. You can suspect the liver disorders right now, biliary disorders right now by jaundice if you marked the yellow scleras. And patient can be considered as a person with a disease of this organ or system, hepatobiliary diseases. So that's key point. Methods. How to visualize liver. By such a way, look, CT is very informative. An arrow indicates the abnormal connective tissue, degenerative nodules in liver parenchyma. You see, large liver. This is a spinal column, processus spinosus. Yeah, this is a large liver. By the way, this is a large person is lying down. Legs are directed to us, yeah, at the back. So this is the right side of the patient. Here, CT shows the enlarged veins, esophageal veins in patients with cirrhosis. Lab studies pancreatic juice, activity of enzymes, pancreatic function test, stool test for indigested fat, the so-called steatorrhea, level of fecal elastase as an indicator of disorder, of chronic pancreatic disorders. So we didn't discuss pancreas today, but as an example of informative tests in GIS pathology, I'd like to show you this slide. So to check the function of pancreas, such method as elastase activity in feces can be recommended. As an example, not only, of course, but we have no time to list all of them. Let it be a informative example. Pancreatic function tests are divided into endocrine function and exocrine function. Endocrine function of pancreas is secretion of some, who knows, some hormones, insulin, glucagon. So it will be discussed in the topic devoted by endocrine system pathology. But to check exocrine insufficiency, doctor must prove the presence of high or low concentration of enzymes produced by pancreas in direct tests, or more convenient indirect tests, the so-called breathe test for activity of pancreatic enzymes. If without detailization we have a wide spectrum of tests to check function of pancreas. I meant enzyme secretion, not hormone serum, but enzyme secretions. Unfortunately, they are not very informative during early stage of the diseases. And how to see pancreas? This organ is worth to be examining by the doctor because of placement, yeah, quite near the back, retroperitoneally. That's why to investigate pancreas, we must use methods of visualization. What are they? First imaging study is computed tomography. Well known. Unfortunately, computed tomography is not very informative during early stage of pancreatitis. We are discussing chronic pancreatitis as we are therapeutists till the end of these lectures, at least, yeah? So chronic pancreatitis can be seen on CT, can be proved by CT during moderate to late stage, yeah? But let's look what's informative. Here, this is a pancreas, chronic pancreatitis. And this is a large dark spot, means a cyst, pseudocyst, in the pancreatic tissue. Another pretty picture, pretty for us, of course, not for patients, pancreatic pseudocyst, you see? Rounded by yellowish. Next. That's interesting picture. Look, this is a projection of pancreas. This is organ. But parenchyma is heterogenic due to presence of stones. Such spots mean the presence of stones in projection of pancreas. That's why we can be sure 100% that this is pancreatitis, first chronic, second alcoholic etiology, as 99% of pancreatitis with the stones are due to excess of alcohol intake. Another hard pronounced method, yeah, But I'd like to show you all the abilities of modern gastroenterology. It doesn't mean that you learned all of them in details in first lectures, but at least to get suspicion, to get impression about abilities of modern gastroenterology. That's okay, yeah? So, the name of this method is endoscopic retrograde cholangioppancreatography. Endoscopic means performing by endoscopy with specific equipment. Retrograde means contra-physiological direction of tube inserting. So we'll investigate organ, we'll insert the equipment in duct against the direction of juice flow. That's why retrograde. Endoscopic cholangiopancreatography. So both organs will be investigated. Look, this is pancreatogram. Contrast enhanced photo, contrast enhanced film can show you the common duct, Wirsung duct. Look, how many problems here. First, enlargement of these ducts. Second, presence of stones in the diameter, yeah? Such narrowing. Cholangiogram. Next step in diagnostics is magnetic resonance cholangiopancreatography. Now I'll show you MRCP. This picture is much more interpretable, yeah, by unexperienced eyes. So look, what organ can we guess here? They indicated, yeah. This is a gallbladder. This is choledach. This is a duct. This is a projection of pancreas, you see? So pretty projection, yeah. And all these 3D structure, it can be considered the distances between organs, yeah? They are available to be diagnosed. Another example of magnetic resonance image for cholangiopancreatography. You see, it was contrast enhanced investigation. Then we can see the shape, size, and projections of all the all organs and anatomic substrates in this area. Plenty of stones here. But really, it can be diagnosed easy by CT scan, yeah? And even sometimes by ultrasonography. Cheap, quick, available ultrasonography sometimes. If no, CT. And last maybe method for today is endoscopic ultrasonography, the modern method. Not available in each clinic, quite expensive, but very informative. First person is directed to this investigation. He will got specific stimulation by secretin. And then endoscopic ultrasonography will be performed. So it will be recorded from inside of GIS. Look. This is a normal layer for gastric wall. Gastric wall, you see how it's unexpected. Yeah. This is, you see, some disorders at the level of stomach mucosa. So this damaged area is susceptible to, can be suspected as plus tissue or tumor. So biopsy can be get from these areas. And let's summarize. Each doctor in any country must follow the principle of optimal diagnostic relevance. The idea is to check, to list the minimal number of tests the minimal number of imaging studies to get maximal information. And I showed you some even quite not exotic but very rare, expensive new methods. As a rule, diagnostics is available at the background of more available, more routine methods. For example, 99% of gastritis and ulcers are verified by endoscopy plus biopsy plus HP testing and the same. But in any case, I'll glad if you got some information which is not such popular and you got some impression about variabilities and a wide spectrum of modern diagnostical methods in CVS and GIS systems. I hope this abbreviation became quite commonplace for you. So let's finish. Goodbye, best wishes, see you next lecture. I don't know when to end, but in any case, best wishes.